Thank you everybody for your attention. My name is Dave Sloan. I will be talking to you today about our instrument, which we call AQS³pro, and our technology, which is called Microfluidic Modulation Spectroscopy. What will MMS do for you? What is Microfluidic Modulation Spectroscopy really about? At the heart of it, it's a mid-IR based spectroscopy technique that's used for measuring protein secondary structure. It can be used for looking at aggregation, it's used in formulation work, it's used in stability work. To compare it to some of the other existing protein secondary structure technologies, such as CD and FTIR, we're about 20 times faster than looking at FTIR. We're about 30 times more sensitive than FTIR. And the real benefits of the technology are that it de-risks the downstream product failures. It gives the biotherapeutic scientists a heads up, an early look at, will the protein be stable? Will the therapeutic make it through the rigors of the clinical trials process? Do you have the right formulation? Do you have the correct excipients? Can it make it to the concentrations that are required to be an effective therapeutic? It's really all about giving you confidence in your biomolecule because it's a long path to make it into a therapeutic. How do we do it? How does the technology really work? There's really four pillars to the MMS technology. The first is a quantum cascade laser. The quantum cascade laser gives us about 1,000 times more light than you get from the black body radiation or the glow bar that's used in an FTIR. This gives us a whole lot more sensitivity, and this allows us to work at both low and high protein concentrations. It is a fully automated technology. We do use a 24 or a 96 well plate. It is walk-away automation. You hit start, you go do something else, you go home, you come back, it's fully analyzed data. So it really has a superb workflow, whether you have a high or a low throughput need. Also the software, there's a great analytics package, which makes it so you don't need to be an expert in spectroscopy. It allows you to get answers. It allows you to get information about the secondary structure, about the similarity, about the reproducibility of the sample or samples that you've run through your platform. And really the last and most interesting part is the microfluidic flow cell. We are modulating back and forth between sample and reference. This is really the key to the technology. This is what allows us to run the assays at high concentrations in formulation buffer without any interference from water, without interference from excipients, without any problems from any of the buffers or additives that you want to put in your sample. It is the microfluidic flow cell that really enables the AQS3 and the MMS technology. I will get to a little graphic of what's going on there in a minute or two, but for now, let's suffice to say that that's what the flow cell looks like. QCLs, or quantum cascade lasers, what do they really buy us? First off, we're looking in the amide 1 region. We're looking in the 1600 to 1700 wave number region, where there is a huge amount of information about protein secondary structure. You can look at alpha helices, you can look at beta sheets, you can distinguish between inter and intra molecular beta sheets for identification of aggregation or early indications of aggregation to come. We do have a very high dynamic range. We can go from about 0.1 mg per ml, which are the lower concentrations, which groups usually have in the earlier drug development process. We can go up to 200 mg per ml or higher, which are the concentrations that people are often encountering in the later stages of drug development, when you are looking to analyze the stability or the structure of your molecule at formulation strength, when it is at the dosing concentration. It's a high quality QCL laser. We have minimal laser drift, which gives us great accuracy, and it allows us to probe the protein backbone. We're looking at hydrogen bonding in our protein secondary structure. And last but not least, I mentioned it before, it's this microfluidic flow cell that allows us to do a real-time background subtraction. One of the challenges with subtracting out background or subtracting out any contributions from excipients or water is that there is drift. There's drift with temperature, there's drift with laser time, there's drift as you separate out your two analyses. We're doing it in real time, so there is no ability for there to be drift or changes, which allow us to get really great reproducibility and very accurate results. I promised a little graphic, and assuming my little graphic works, this is our flow cell again. I flip the orientation. Sample goes into one leg of the Y, buffer or reference in the other leg of the Y. The little red spot is where the laser is interrogating the sample. Some specifics about the flow path. Just to mention it, it is a non-destructive technology, so if you are dealing with a precious sample, if you are dealing with samples that you need to do other downstream analyses, you can recover the sample. You can recover the sample after it's been analyzed, and if you want to run it again or use it in a different downstream process. It is slightly diluted as we are mixing it with sample and buffer, but you can also reconcentrate it if necessary for doing any other analyses. So what happens? There's a little graphic that goes on here. When you hit the start button, the sample and the buffer are propagated through the fluidics. They fill up your flow channel, buffer, sample. When you hit start, the instrument automatically modulates back and forth between sample and buffer at about 1 hertz. It is working through the amide 1 region at 4 wave number spacing as it measures sample, buffer, automatically subtracting the buffer from the sample, giving you the differential absorbance of only your protein of interest at each of those wave numbers. We interpolate between the spacing, little spectroscopy, differential absorbance, interpolation, software automatically does some math, do the second derivative to highlight the small differences that you might see between sample and reference, invert it because people like to see things that are upside down, we background subtract it just to normalize for any concentration differences that may be in there as well to give us what we call our similarity spectra. Software automatically compares either replicates or between different samples that you are running. For calculating similarity score, we also measure WSD or weighted spectral difference as well if you want to highlight the differences in different regions of the spectra. Last but certainly not least, we fit a family of Gaussian curves to that spectra, which will calculate the percentage of all the higher order structural elements that are present in your protein. We then just give you those percentages. We give them in table format. We give them in number format, easily exported into Excel or anything else that you might want to look at. Not everybody cares about the details of the spec, but I'll give it anyways. Just showing some of the different regions and how they relate back to the different secondary structural elements that we're looking at. This is based on years and years and years of FTIR work that's been done with peptides and known structural elements. These different wave numbers, these different regions, and the different different secondary structural elements that they relate to are very well characterized and very well accepted. If you have a different system, if your molecule is a little bit different, it is an open platform as well. You can modify any of the definitions that you might want. You can assign the different spectral regions to different secondary structural elements should you be so inclined. Talk about automation for a moment or two. I mentioned its walk away, 96 and 24 well plate. We do have a chiller if you want to maintain your samples at 10 degrees during the analysis, because if you do have a large number of samples, it's normally an overnight run to some extent. We do have loading guides which help loading the 96 well plate, but it's quick, it's easy. You fill up your plate, you snap it in the instrument. There's a software interface that controls it all. You hit the go button and the instrument does all the heavy lifting and you get to come back to data. You can watch it while it's running if you want to watch it while it's running. You can also use the software for other analyses if you want to while the instrument is in use. What is the typical workflow? It takes somewhere about 15 to 30 minutes to prep your plate, depending on how many samples you're putting on the plate. No, you don't need to have a full plate. You can have a partial plate if you want to. It's completely up to you. Loading the plate in the instrument, prepping the instrument for run takes about 5 minutes. It is a fluidic instrument. There are some prep steps that get done. There's some cleanup steps that get done on the end, but it's all automated. You don't need to be there. You can set up for timing whenever you want to do it. When you're ready to hit start, you prep the system, you hit the start button. All in all, it's about 30 to 45 minutes to get your plate going, and then it's completely hands-off automation. but you can watch it from remotely, or you can sit there at the instrument and watch it if you want to, but it is unnecessary. A couple of quick features of the software. There's a great graphical user interface. It does walk you through everything that you need. There's quick start protocols, there's data analysis, there's some of the maintenance that's easy to automate and easy to set up, so you don't need to worry about it. Really, training takes about an afternoon. We do a couple of runs during the training process, but it's about an afternoon's worth of training to get everything going. Quick comment on the data analysis. This is just an example of a MAB fragment, which happened to be at 1 mg per mil. This was a temperature analysis that we're looking at, so we were looking at samples from 24, about room temp, up to about 80 degrees. You can see the family of differential absorbances that get generated just as the first step in the analysis. You can see there's an obvious change as you're melting the sample, as you're heating it up. The peak is decreasing, the peak is shifting. It's the raw data, the differential absorbance. We also measure concentration as part of it as well. This was not a concentration titration. I'll show concentration titration data later on, but we do have a great linear dynamic range. Take the second derivative, as I said. One of our plots is called the delta of the absorbance, absolute absorbance, absolute AU. And what it does is it highlights the wave numbers or the regions where we are seeing the greatest difference. It allows you to very quickly say, where are the spectral regions of interest? Where are the regions that are identifying the differences that are happening based on the stress, in this case, thermal stress? We'll also show it in a different way. If you plot it just by wave number, you can see the 1624 is dramatically increasing. It's a hallmark of intermolecular beta sheets or aggregation. You can see the 1641 or the intramolecular beta sheets are dramatically decreasing. This goes along the molecules aggregating as we're heating it up. Area of overlap will just give you a percentage score or a similarity score. How similar or different is my molecule based on the stress we've applied to it? Like I said, the Gaussian fits for the higher order structure, and then you can see the various structural elements that are present and how they are changing with our stress, with our temperature. All of this is done essentially automatically within the software. There is no real manual manipulations that need to be done. It makes spectroscopy very easy and very approachable for the average biophysical scientist. We do have a 21 CFR Part 11 compliant data package as well. It does all the annoying things that you want it to do. It makes you log in. It makes you log in again. It makes you annotate any changes that you may have done within the software. You can have different permissions, so you get that warning from time to time. You can't do that. You don't have permission to do it. It's what the 21 CFR Part 11 compliance was meant to do. It's meant to have people have their functions and only do those functions and verify who they are to accomplish those functions. IT people love it because you can do all sorts of the IT things that you need in terms of regulating logins, regulating passwords, regulating expiration dates. The whole workflow, biophysical characterization relies on a lot of different techniques. Each technique adds something to the puzzle or confirms something you've seen before. We work with a lot of people who are doing DLS for some level of aggregation or size that you're looking at. MMS gives another indication of aggregation, but more information about the higher order structure and the percentages of the higher order structure. We fit into the family, we fit into the continuum of analyses that are being done. DLS, SLS, SEC, AUC, previous speaker spoke about MFI, all part of the puzzle for understanding what is your protein looking like and how is the molecule working. Why do you need to see change? Why is it important? It's critical for structure-activity relationships. If you expect the molecule to behave the same way, it has to look the same way. It has to have the same structure to function as it did before. It's important in formulation work. It's really important in biosimilars or comparability type of experiments. It's critical for quality control and batch-to-batch reproducibility. Super important when scaling up from small scale to big scale. Does the protein look the same? Is it going to function in the same manner? Kind of a general overview of just some of the applications, some of the areas that we play in. Somewhere on this point, someone says, hey, why is it called the AQS3? AQS3, there's 5 measurements: aggregation, quantitation, stability, similarity, and structure. That's where the AQS3 product name comes from, and the family of applications and activities that people do on the instrument. Now I'm going to kind of turn over and look at some application areas, a couple of quick case studies. So mentioned application notes, work the team does internally. We have a family of application notes. It's always growing. Please check out our website. Look at our various application notes. Look at the work that we've put out, sometimes on our own, sometimes in conjunction with some of our users who are happy to talk about their work. Growing list of publications, publications by major pharma companies, publications by CDMOs and CROs as well. The technology is out there, the instrument is out there, it is being used productively in the biotherapeutic development process. Again, all the publications are on our website or PubMed. A couple of quick application areas. This work came from Merck. This was a vaccine formulation study that they were doing. What we were looking at is we were looking at 2 different concentrations of their vaccine sample. It was a thermal stability study, 65 degrees for 30 minutes. They happened to run our 24-well plate because they didn't have all that many samples. A quote from the publication that came out of it essentially was saying MMS, or Microfluidic Modulation Spectroscopy, was addressing a lot of limitations that they were seeing with other technologies they were working with. Some data. We're looking at the raw absorbance. We're looking at the high concentration, the low concentration, the control, the stressed, the control, the stressed. When you go ahead and take that second derivative, it highlights the differences. This is also normalized, so the concentrations are now overlapping on top of each other. We're highlighting the 2 regions of change, the 2 regions of interest. You can see there's a dramatic increase upon stress at 1620 wave numbers, and there's a decrease at 1637. Software quantifies everything. It's a 29% increase in intermolecular beta sheets, which was a hallmark of aggregation. We were seeing very early indications that aggregation was a problem, or going to be a problem, due to the stress. Some of the highlights from the publication, I especially like this. All 5 MMS measurements were completed in less time than a single measurement took them on FTIR. They were able to do more with less time. Much more sensitive, we were looking at lower concentrations. FTIR is normally 10 mg per mil or higher. We go from the low to the high. Overall, it fit into their workflow. It gave them results that they needed to understand the biomolecules they were looking at. Quick study from Pfizer, looking at critical quality attributes, CQAs, for their biotherapeutics. They wanted to look at linearity. They wanted to look at reproducibility. Again, a quote from the paper, safety and efficacy of therapeutics. It's really critical to understand the higher order structure or any alterations in that higher order structure so that you can understand aggregation, immunogenicity, and loss of function. Linearity. In this example, they were going from about 87 mg per mil down to 0.5 mg per mil. I said we go from about 0.1 to about 200 mg per mil. They were within that region. They saw a really good linear dilution of their biotherapeutic that they were looking at, and they commented that they'd never been able to go below 20 mg per mil for the FTIR analysis that they were also doing. Reproducibility, 2 days, the blue and the red, day 1, day 2, same scientist. Day 3, second scientist is brought in the picture. Really good overlap, really good reproducibility. At about 2 mg per mil, we're generally seeing 98 to 99% sample-to-sample reproducibility. So it's really able to see very small changes in similarity in overall structure or in individual higher structural elements because of the reproducibility. These are the individual higher structure elements looking across day and across analyst. Repeatability, because of the automation, is extraordinarily high. Conclusions from the study. MMS has great potential to become the primary characterization tool to elucidate the routine product quality attributes for protein secondary structure for therapeutics. Again, these are quotes that are taken out of the publications that I'm highlighting. One last example I want to give comes from KBI. KBI wanted to understand what is the lower limit of quantitation, or what is the smallest structural change that they would be able to detect. This was a spike-in experiment. They said the reason they did the study was little work had been done to elucidate the overall lower limits of quantitation, or how small of a change could be detected. This is a head-to-head-to-head study looking at FTIR looking at MMS and looking at CD. They started off with an IgG. They were spiking in small concentrations of BSA. IgG, predominantly beta sheet. BSA, primarily alpha helix. It's going to make it easy for us to detect the spike in because it's a dramatic change in secondary structure. It's a change from sheet to helix. FTIR on the left, CD on the right, MMS in the middle. In this particular experiment, we matched concentrations with FTIR. 20 mg per mil, 20 mg per mil. CD, it's very challenging to go to that high of a concentration. CD is usually 5 mg per mil or below. And if it is 5, it's one of those wafer-thin cuvettes that you're working with. In this study, KBI was working with a 1 mg per mil CD solution, so it allowed an easier cuvette to work with. If you look at it, you can kind of see what's happening. We give very comparable type of data to FTIR. When you go ahead and look at the lower limits of quantitation, or what percent of BSA could we reliably detect in that solution, MMS was able to see 0.76% BSA. We could detect less than a 1% addition of BSA, or a 1% change in secondary structure. FTIR, it was closer to 20%, about 22%, mostly due to the high variability that you see with FTIR. It's not automated. It's not nearly as user-friendly. CD does better. CD was at about a 4% limit of quantitation. So CD was able to see smaller changes. The thing that's notable is because you are locked into lower concentration regimes with CD, you can't always measure at formulation strength in formulation buffer. You're frequently needing to dilute your sample to do the analysis, which makes it a much less meaningful analysis. 5 times more sensitive than CD, 30 times more sensitive than FTIR. This was the data set I was mentioning before when I said the 30-fold better sensitivity. Much quicker to run on MMS than it is on FTIR as well. CD falls somewhere in the middle. There are some automated CD platforms that do allow you to speed up the analysis, but if it is a manual platform, it also takes a large time to do it. A couple of the quick conclusions from it. Really, MMS gave much better limit of quantitation, much quicker, much easier to use. With that, I will end, and I'll take any questions that people have. I should mention, I do have a poster. The poster does go over that last data set that I showed from KBI, poster 35. We also have a booth, booth 208. Please feel free to visit me or the rest of the team at the booth.